All right, so using my awesome drawing and awesome technology skills, we are going to discuss AVNRT today. Stands for Atrioventricular Node Reentry Tachycardia, one of the most common indications for a person to get ablated and a really common cause of tachycardia in general. And so here's an AV node, poor representation of one. It's important to know that the AV node has two pathways. It has a fast pathway with a slow repolarization time and a slow pathway with a fast repolarization time. So kind of jumping to a normal AV node, you got your SA node, discharges, setting a pace, comes down, hits the AV node. Once it enters the AV node, it will go down the fast pathway first. Not sure why, it just does. So once it enters the fast pathway, comes down, depolarizes, hits the His bundle, and then depolarizes into the rest of the ventricle. And then kind of lagging behind that is your slow pathway, much like the tortoise and the tortoise of the hare. This guy will just come up, go, and then it'll hit this node or this place where they all kind of join up again. However, keep in mind that recall that after a neuron or something depolarizes, it needs to repolarize, and during that repolarization phase is a refractory period where nothing can happen. No matter how hard you try to push or throw electricity at it, it can't discharge. And so the slow conduction that happened kind of dies here. Can't go down this way because it's repolarizing, can't go up this way because it's repolarizing. And that's great. That's exactly what you want. Your heart's going to contract the way it should. Everyone's happy. All right? But then we get into sad face, or the premature beat. So let's say, for instance, person has a APC where you get an aberrant firing of the SA node. All right. So in this case, let's say the fast pathway is done depolarizing, right, and it's in its refractory period. As the SA node fires during this aberrant beat, it can't go down the fast pathway anymore because it's in its refractory period. So it's going to go down its slow pathway. As it goes down its slow pathway, which is ready to go because remember, it has fast repolarization time, it's going to come down the slow pathway. Once it hits that junction before it heads off into the bundle of His, if everything is timed just right, the slow pathway can re-enter the fast pathway. And so a lot of electrophysiology people who try to dumb it down for us have this saying of down the slow, up the fast. And that's, as you can see, exactly what's happening here. You're going down the slow, and you'll eventually go up the fast, which is ready to be depolarized again. And so as you can imagine, you start going into this loop of just down the slow, up the fast, down the slow, up the fast. And every time it makes this loop, it lets off a little bit of electricity into the bundle of His and into the ventricles. And so what you can end up getting are heart rates of 100 to even 250 beats per minute. The treatment for this is to do ablation therapy, where you kind of run from the AV node down to like a part in the tricuspid annulus, getting rid of portions of this slow pathway so that in the case that you do have a premature beat or an APC or something like that, you don't have the option of going down this pathway, and instead it kind of it can only go through the fast pathway. Ablation therapy is almost 100%, not 100%, I guess. Nothing in medicine is 100%, but it's almost certainly definitive and for this condition. And patients who do get ablation therapy generally clear right up with it. That's it.